Hi, my name is Tammy Adams, and I'm an educator at the Stephen and Barbara Slaggy Family Mayo Clinic Cancer Education Center. And today we're going to be talking about wellness. And as you know, there's many things we can do to keep ourselves well, whether it's eating right or being with our social contacts or even physical activity. So today we're going to be specifically talking about physical activity and cancer. In this session, we'll learn about the benefits of physical activity, and we'll also describe what a comprehensive program may look like and some tools that may help you to design your own physical activity program. Today, patients with cancer are living longer, and we have over 17 million Americans at this time that are living with cancer, and we expect that number to grow to over 25 million by 2050. A structured exercise program is the foundation of cancer prevention, its management, and a strong recovery. Research has been going on for many years about physical activity and cancer. At one time, patients with cancer were told to take it easy and not to exert themselves or do any physical activity. Well, the American College of Sports Medicine has done much research, and they have current recommendations recommending that physical activity is safe for all patients with cancer. And in 2019, in the fall, they came out with new guidelines, even reinforcing this need to be physically active. So we'll talk about what that might mean for you. Why would I exercise? What is it going to do to benefit me? Let's just take a moment and think about that. Well, physical activity increases our outlook and our well-being. It actually helps our brain to function better, our cardiovascular system, and our lungs, our respiratory health. It increases our muscle tone, our strength, our flexibility, and can impact our quality of our life. It also can affect our mood. It can decrease our risk for anxiety and depression, also our risk of falls and death from any cause. And as mentioned earlier, it's generally shown to be safe for patients that have any stage of cancer. Fatigue is the number one side effect of patients with cancer. This fatigue can be caused by the cancer itself, by surgery, by chemotherapy, radiation therapy, and it's overwhelming and intense. Also, our functional ability is changed by our physical activity. Now, functional ability is a term that we in healthcare use, but how you might think about it is the ability to do the things in a day that you want to get done. And that might be as simple as taking a shower, walking around your house, maybe going to the grocery store. And so in medicine, we have ways that we measure functional ability. It might be to have you walk for 6 minutes in an area that we've measured out so we know the number. We can put a number to your functional ability. There was a study with women with breast cancer who are receiving chemotherapy, and they had one group that they told them to do aerobic exercise at home. And during this time of 9 weeks, they were actually able to increase their functional ability. Their second group, they did not have them exercise, and on average, they lost 23% of their functional ability over the same 9 weeks. So how do we begin? Well, of course, it's important for us to talk about this with our healthcare provider. There may be some issues that are going to limit your ability to be physically active or some precautions that you need to take. And as always, we want you to begin gradually and slowly for our body. And we want to be realistic. We don't want you to all of a sudden start doing activities that you've never done before in your life. We need to be kind to ourselves and know that making a new habit can take time and commitment.